Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Huria Amir. I welcome all my students of first year MBBS and BDS in this session in portion of heart physiology. And what is that? That is the cardiac cycle. Now this cycle is very important from your examination point of view. It is very important from theory as well as from the viva point of view. So my advice to you all is that you should learn how to draw and label this diagram, its definition, the different segments, what are the portions, what are the different mechanical, electrical changes, etc. They should be learned by heart so that there should be no difficulty for you guys to appear in exams and to pass this subject of heart physiology. Now, what is this cardiac cycle? A cycle is actually the completion of one thing, and this is actually first, whatever thing we are doing, we should be knowing about the definition. Now, the cardiac cycle is actually the cardiac events that occur from the beginning of one heartbeat to the beginning of the next heartbeat are collectively known as cardiac cycle. So the definition of cardiac cycle is that whatever the cardiac events that occurring from the beginning of one heartbeat to the beginning of the next heartbeat, they are all encompassed or encircled by this broad term cardiac cycle. Now, broadly speaking, the cardiac cycle is composed of two portions. One is the period of contraction and the other is the period of relaxation. So, the period of contraction has been given the name of systole and the period of relaxation has been given the name of diastole. Now, each cardiac cycle is initiated by the cardiac impulse, which is originated from the autorhythmic cells, which are the 1% cells of the heart tissue. And what are they? They are actually the sinoatrial node, the AV node, the Purkinje fibers, and so on. But the natural pacemaker, the physiological pacemaker, is the sinoatrial node. Now, this cardiac cycle is actually, when we draw it, we have different aspects. Now, what are the different things which are making the cardiac cycle the cardiac cycle? They are the different electrical changes. There is presence of different mechanical changes like pressure changes, volume changes, production of heart sounds, the closure and opening of heart valves, and the electrical changes in the heart. Now we should be knowing about the duration of the cardiac cycle. Now the total duration of this contraction and relaxation is actually 0.8 seconds. And this is the total duration, and most of this duration is being occupied by the period of diastole. Why? Because this is actually the time during which there is accumulation of the blood into the heart is going on. So more and more time has been given to the heart so that more the blood that comes to the heart and is being later on delivered to rest of the body. So this is just a basic idea. The cardiac cycle is actually all the events which are taking place during one heartbeat. They are also known as the cardiac cycle. The other definition, another definition can be the different electrical and mechanical changes which are occurring during one heartbeat. They are collectively summarized under one roof or one heading, and what is that? That is the cardiac cycle. Now let's see it. You can see the different segments, the different aspects which are actually making the cardiac cycle. Now at the start of the cardiac cycle, there is the late dystole. Both the sets of chambers, they are relaxed and the ventricles are being filled passively. Then there is the period of contraction, right? Now during this period of contraction, we have the atrial contraction, we have the ventricular contraction. Now during the course of atrial contraction, the atrial contraction forces an amount of additional blood into the ventricles. So we should be knowing about then when the blood that is being taken. In diagram number 2, you can see that whatever the blood is coming from the lower portion of the body or from the upper portion of the body are by means of superior as well as from the inferior vena cava. Now most of this blood is going to enter the right ventricle quite easily without any contraction, without any force, but later on there is atrial contraction and further 30% additional blood that is being pumped, that is being forced from this right atrium into the right ventricle. Now then, when the blood goes to the ventricles, there is period of ventricular contraction. Now this is actually having two portions. One is the isovolumetric ventricular contraction, and the other phase is the ventricular ejection. Now during the first phase of ventricular contraction, what happens is that the atrioventricular valves, they are being closed, but it does not create enough pressure to open the semilunar valves, right? And then later on, when in the second phase of this ventricular contraction, we have a rise in the ventricular pressure, and it exceeds the pressure over there in the atria, and this leads to the opening up of the semilunar valves and the blood is ejected. Then after this ventricular contraction phase, we have the phase of ventricular relaxation, and that is the next phase, and this is isovolumic ventricular relaxation. Now as the ventricles relax, the pressure in the ventricular walls, they fall, and the blood flows back into cups of semilunar valves and snaps them closed. Now we have late diastole. With both sides of the chambers, they are relaxed and the ventricles, they are being filled passively. So what we have is the atrial systole and atrial diastole. Then we have ventricular systole and ventricular diastole. So these are the different events which are taking place. Now let's talk about them one by one. Now first is the late diastole. The late diastole, the first phase is the late diastole. What happens is that at this phase, the left ventricle is full of blood, and it is just at the beginning of ventricular systole, and the pressure is 1 to 3 millimeters of mercury, and the mitral valve is open. Now we have atrial systole. What happens is that there is atrial depolarization, ultimately leading to the contraction of atria, and the contraction leads to the rise in the atrial pressure, and the blood flows across the atrioventricular valves. And so we should be knowing about that about 70 to 80% of the ventricular filling is actually the work of is directly or you can say without any force of contraction, but the 20% or 30% is due to additional atrial contraction. So atria, they are also acting as primer pumps. Why the name primer pumps has been given to the atria is because that they are actually pumping the blood initially. 20 to 30% of the blood that is being pumped to the ventricles is by means of these dear atria. Now this is actually the whole, you can see the core knowledge of all this topic of heart physiology, because it is telling us all the events which are taking place within the one heart beat, whatever thing is going to take place, like from the beginning of one heartbeat to the beginning of the next heartbeat. It is enclosing in it the period of systole and diastole. The duration is like 0.8 seconds, 0.8 milliseconds, I mean, and it is actually having different mechanical events, different electrical events. You can see that there is presence of different pressure changes in the aorta, pressure changes in the ventricles, then there is presence of volume changes, then we have the pressure changes in the atria, we have the electrocardiogram and phonocardiogram. Now these all aspects, they can be asked differently, they separately, collectively, and they can be asked in the form of you can say in some MCQ as well, in some SCQ as well. The diagram can be asked to draw and label. You can be asked about describe what are the different ventricular pressure changes taking place during cardiac cycle, and this is actually the way. So all of you should know it by heart, and very soon we are going to study it in detail. Now we should be knowing about each of the waves one by one. The first is we are going to learn about the JVP, which is also the part you have seen this in the cardiac cycle. There is presence of JVP as well in it, and then there is ECG, heart sounds. Now the A wave, the different things which are actually telling us about the atrial contraction, atrial systole, what are they? In JVP we see the A wave, in ECG we see the B wave, and in heart sound we see the S4 sound, which is the pathological one. So we should be knowing about it. You can see the A wave is telling us about atrial contraction. At the same time, the B wave in ECG is telling us, and the fourth heart sound is the pathological one is being seen in it. Now let's talk about this atrial systole. P wave is preceding the atrial systole, and the PR segment is actually the depolarization proceeding to the ventricles. The brief pause allows the complete ventricular filling. Then heart sound S4, which is the pathological one, the vibration of the ventricular wall during atrial contraction. It is heard in stiff ventricles like in hypertrophy and in elderly. Also, it can be heard in conditions like massive pulmonary embolism or cor pulmonale. Then there is ventricular systole. Now this is actually isovolumetric contraction, 0.06 seconds. Then there is period of maximal ejection, 0.11 second. Then there is period of reduced ejection, 0.14 seconds, and the total duration is like 0.3 seconds. Now we are going to talk about them one by one. Let's talk about isovolumetric contraction. Now there is increase in the ventricular pressure, due to which it increases even that of the atrial pressure, and there is closure of atrioventricular valves occur. Now the ventricular muscles, they are contracting powerfully but isometrically, and they are leading to increase in the ventricular pressure, but there is no blood ejection up till now, so the blood volume has not been changed. And when the ventricular pressure reaches now up to 80 millimeter of mercury, there is opening of the aortic valve, which is going to last for about 0.05 seconds. And this is actually at the time when the blood volume changes, because ejection of the blood starts at this point due to opening of aortic valves. Again, you can see the period of isovolumic contraction. You can see how the pressure that is increasing, which was previously about 0 millimeters of mercury, and during this course of isovolumic contraction you can see the pressure rises up to the 80 millimeters of mercury, and there is opening of aortic valve, and then there is period of ejection, during which the pressure now which was increasing up till 120 millimeters of mercury, it starts to decrease, and when it decreases starts to decrease, there is actually the closure of aortic valve occurs. So this is going to give rise to the you can see the dotted upper black line of aortic pressure changes in reflection of how the isovolumic contraction, then ejection, and then isovolumic relaxation, they are going to give rise to how the pressure changes they are actually occurring in them. So this aortic valve is going to open around 80 millimeters of mercury, and again it is going to close when the so you can see that it is very much voltage gated valve opening and closing. So this is voltage dependent opening and closure of aortic valve. So this is how the aortic pressure upper dotted curve that is being produced. Then we have the JVP, the changes which are being seen. They are the C wave. Now the C wave is actually being produced due to the bulging of tricuspid valve into right atrium, which is secondary to increased pressure in the ventricle. Then later on there is X descent, and in ECG we are going to see the QRS complex, and in the heart sounds we are going to see the S1, which is due to the closure of atrioventricular valves. And normally the split as mitral valve closure precedes tricuspid valve closure. Then we have the ejection, the period of ejection. Now what happens is that when the left ventricular pressure increases more than 80 millimeters of mercury, the right ventricular pressure exceeds more than 8 millimeters of mercury, there is opening of the semilunar valves, right? So we have to remember the left ventricular pressure range of 80 millimeters of mercury and the right ventricular pressure range up to 8 millimeters of mercury. The semilunar valve, they are going to open and the muscle is contracting powerfully but isotonically, and the duration is about 0.14 seconds. The arteries, they become distended due to presence of elastic tissue. Now is the period of emptying, period of ejection. Now this ejection initially is very rapid. You can say that around 70% of the ejection of blood is quite rapid ejection phase, and the rest of the blood which has been remained is quite slow ejection. So the word slow ejection has been given to it. The pressure in the ventricle keeps decreasing until it becomes lower than that of the great vessels. This phase ends when the ventricular pressure equal or slightly is less than